Earthquake intensity is measured on the Richter scale. Gasoline quality is measured on the octane scale. Now, a team of researchers have developed the first standard scale to measure the skin's aging process. It's called the Mertz scale, and it's designed to create a standard means of quantifying the effects of aging on skin, a universal language of aging. The Mertz scale was introduced this spring at the American Society for Aesthetic Plastic Surgery's annual meeting in Las Vegas. We asked Dr. Corey Moss, a Mertz scale investigator, what the new system means to the average patient.
Well, the development of the Mertz scales came out of really an apparent need, and I think a lot of investigators in other clinical trials had been discussing the relative absence of any kind of standardized methodology for measuring wrinkle improvement. And Mertz came in and really got in the lead of this and created a panel of expert physicians that were able to get a consensus on scales for wrinkles in different areas of the face. Initially, consensus was built around what the scales would look like and what the parameters would be for the severity ratings, and then went back and tested and retested to make sure that those scales and the grading severities that we had developed were reliable and statistically reproducible.
The Mertz scale's creators hope that the rating system will serve as a stable platform for describing the condition of a patient's skin, making diagnosis and treatment more effective.
The way that these scales will help all of us is if we can talk in the same terms, in scales that are universally accepted, both amongst ourselves in terms of evaluating products that impact aging and wrinkles, etc., and or technologies and or procedures that we do, not just products. I think we'll be able to be a lot more clear about what outcome measures we can expect or what we're seeing with these different treatments. Similarly, with patients, if we have scales that are more widely accepted and easy to discuss, which I think these scales are, I think it's a lot easier for us to put outcomes in a framework that patients understand. So the scale development project has both a functional academic sort of use and then more of a practical clinical use that I think that all of us will find valuable.